Well, welcome everyone. We are actually broadcasting over the internet, so there'll be a number of people out there in internet land listening in as well. Today, I would like to just go over a little bit about the history of our program here at the Reardon Clinic and how it fits into what's going on around the world. Because as I'm going to show you, the issue that relates to people who have had problems with their weight is not just a problem here in the United States. I thought that it was a pretty big problem here. About 70% of Americans now are struggling with their weight. It's actually worse in China and even worse in India. And so it turns out that it's a global phenomenon. And so the biggest issue is that no one exactly knows what to do. And so, but we do. We have been working over the last year on a program that we initially described almost strictly as a weight loss program. But what we have found is that in order to really give it due diligence, you can't just think of it as simply attaining weight loss. That's great, and for a lot of people that's a big struggle in and of itself. What's an even bigger struggle is sustaining weight loss and arriving at a higher level of personal health and well-being. And so for that reason, we have kind of expanded the concept of our program, and it is now called the Reardon Clinic HCG Rx Plus Life Care Plan. I'm going to just take a minute and explain to you why we put all these different little titles in there. As many of you may be aware, HCG was basically taken off the market as a homeopathic, which as in a prior lecture that we've given here, Dr. Kalman gave a lecture on the fact that homeopathic HCG, probably the basis for it is pretty shaky. So what we've always offered here is the prescription version of HCG. It is regulated by the FDA, and I'm going to talk about that in just a minute. But we didn't want to leave it just at that we're giving people prescription to help them lose weight, because that's, I think, a misconception of what needs to be done. There is no one thing that will solve the problem of obesity in this country and in the world. You have to look at it in a total lifestyle perspective. And from that perspective, that's what that little plus means, is that we have discovered that there are a number of things that people need to be paying attention to as they're going through the weight loss process. So this is not just weight loss, it's lifestyle restructuring and transformation. So what is the core issue? Well, it turns out that the really core issue is visceral body fat. This is an abnormal type of fat that accumulates in the body that causes additional inflammation and insulin resistance and other problems that set you up for failure, actually, and makes it very difficult to not only lose the weight, but then those same forces tend to cause a regain of the weight later on. So I'm going to go ahead and give kind of the theory today, hopefully do that in about 30 minutes, and then Meg Fuson, who's our nurse educator for the HCG program, there's Meg, will be up and join me, and we'll answer questions about the practice of it. So think of this first part as the theory and the second part as the practice. I have quite a few slides, but I'm going to go through them fairly quickly so you'll kind of get more of an overview of what's going on here. So most people have no trouble identifying themselves as being in the category of someone struggling with their weight. What you may not be aware of is that there's two kinds of weight. They're the apple and the pear. The apple is the visceral body fat. The pear type shape would be subcutaneous fat. No one really wants too much of either one of those, but the ones that seem to be causing more of the diabetes, the high blood pressure, the increased risk for various illnesses is the apple shape or the visceral body fat. And so this is a CT scan cross-section of the abdomen, and you can see in a typical person they do have some visceral body fat scattered around their organs. This is the spine. But someone who is suffering from pre-diabetes, it's also been termed diabesity, they have quite a bit more visceral fat than what their body likes or wants. It's almost like it's just packed in there. And this visceral fat actually creates cytokines. It becomes a kind of organ in and of itself that triggers inflammatory responses, insulin resistance, and other problems. So just to show this from another perspective, we all have reserve body fat, and fat itself is not bad. Fat gives definition to your face. You need fat on the sole of your foot, otherwise you'd have sore feet all the time. Baby fat, there's something good about fat as well, even though after a while you begin to wonder. But that's the reserve body fat that if we don't eat for a few days, we can draw upon that energy source. And that's what fat is supposed to be, as kind of a reserve supply. And structural body fat, as I mentioned, gives us definition to our body, and we need that too. But and one of the problems with dieting is that it tends to take away the wrong kind of fat. Very often people will lose the structural body fat. They'll start to sag, their face will look drawn, they'll get sore feet, and they're actually missing some of the fat that they need. So what we're wanting to get rid of is this visceral or abnormal body fat that is stored but very hard to get to. The body is almost like saving it for the last possible emergency that could come along. This visceral body fat is causing a lot of concern in everyone, men and women. Men especially, many of you may not know, but the #1 cosmetic surgery being done in the United States now is male breast reduction, because visceral body fat also has an enzyme called aromatase, which will convert male testosterone into estrogen. And so men are becoming estrogenized in that same process. In women, they tend to get facial hair. And so women, their estrogen is being converted into testosterone. So there's a number of adverse things that happen as a result of the visceral body fat. Along the bottom here, I'm going to show you this. This is where we're going to end up. But I'm going to show you from the CDC a series of slides. Every slide is only going to last just a few seconds. But this is just going to show you how fast this obesity epidemic has come on to our culture. And maybe some of you have already seen these slides. This is starting in 1985, and just to kind of orient you, the color, the white slides, there's no data. The light blue slides or gray is less than 10% of that state had people with a BMI greater than 30. That's the definition of obesity, is a BMI, body mass index, greater than 30. And in the blue states, there was 10 to 14%. And you'll see that additional percentage colors will be added along the bottom. And okay, so now we're going to go to 86, 87, 88. You see more blue. 89. This is 1 year. 89, 90, 91, 92, 93, 94. The dark blue now is the 15 to 19% of that population is overweight. 96, 97. Oh, now we're getting above 20%. The yellow. 98, 99, 99 is not that long ago. 2000, 2001, and you see now we're getting some orange, which is greater than 25%. 2005, you can see how this is really clustered down in the south. That's kind of interesting. 2006, 2007, but now it's everywhere. Just about every state in the union. There's something about Colorado they're kind of holding out there. They're exercising more or something. But there's 2009, and that's the last data that I have. But remember where we started, and that's just in the span of 20 years, 20-some years. We have this. It looks like a plague that's just enveloping the nation, and not only us, but it's enveloping the world. And so we have to wonder what in the heck is going on here. What has changed so drastically to bring this about? So this is kind of just a general summary slide. And down along the bottom here, we only have one state that has 15 to 19%, 16 states with 20 to 24%, 24 states, 25 to 29%, and 9 states with greater than 30% people who are in the obesity category. And that's just 2009. We've had another 2 years elapse, And I'm sure that it's gotten worse instead of better. And all of you who have looked at this issue know that as you gain weight, it's not only is it something you don't want for a number of reasons, but from a medical point of view, there's a definite increase in mortality from a number of illnesses, cancer and heart disease. There's a decreased morbidity. Morbidity means you just don't feel very good, you don't live very well. Your quality of life goes down from sleep apnea, low self-esteem, depression, stress, incontinence, infertility, increased cancer rate, and sedentary lifestyle. So no one, and anyone that you've talked to who is overweight, no one wants to be overweight. And there are some doctors, unfortunately, that have this notion that people derive some kind of secondary benefit. I don't think there's any secondary benefit that I've found from being overweight, other than some people for a while, when they kind of give up, there's a kind of a relief. Well, I'm not even going to try anymore because so many things have failed for the people who are struggling with this condition. But even that is a temporary relief. So what we're talking about here, and if you're not sure if you fit into this category, all you really have to do is know what your pant size is or what your abdominal girth is. Because if you have an abdominal girth of over 35 for females, greater than 40 for males, you have the metabolic syndrome. You have insulin resistance. You have a tendency to store visceral fat. You have a tendency for abnormal lipid scores. And you have high blood pressure, and your blood sugars tend to run high. The people that are going to their doctors with these conditions, they're being treated piecemeal with medications to treat the individual manifestations of the condition, but the actual condition itself, the insulin resistance, is not really being addressed, other than if you get bad enough, the doctor says, well, maybe you better have bypass surgery or stomach stapling or the lap band or something like that, which are very expensive, and they do have some, they can have some serious long-term consequences. The good news is that if you are struggling with your weight, if you can lose 10% of your body fat, notice I said not body weight, but body fat, that significantly will reduce your mortality and your morbidity risks. Just a 10% reduction. We have a gentleman who's kind of our poster child, Roger, who has lost 140 pounds. He still weighs 380 pounds, but he has significantly reduced his risk for illness, and his quality of life has gone up dramatically. I was on a radio talk show with him in Salina, and he feels like he's got his life back. He's still got a long ways to go. But this 10%, the thing I want for people to think about is that this is attainable in one session, one cycle of the HCG. So part of what we do, I think we do, and I think Meg will echo this for me, is that people come in a fairly deep state of depression and hopelessness because they've tried so many things. A lot of things, they just don't lose weight anyway. They go on the diet and the weight doesn't budge. Or they've lost the weight and slipped up one time, and it seems like it all comes back in one fell swoop. And so what we're working on is we want to go beyond attainability into sustainability. And I believe this program has the ability to do that now that we've added the life care component to it. It's not a new program. It was developed back in the 1950s by this Dr. Albert Simeons, who was he was a very respected endocrinologist. After he did a lot of his work in India, he moved to Rome, where he started studying what at that time was a rare disease. Back in the 1940s and 50s, obesity was quite rare. It was really just showing up among the rich and famous who had access to a lot of high carbohydrate, sugary type foods. And now those have become everyday types of things that's available to the world. And so we're seeing the consequences. Now, I'm sure there are other factors, but that's one big factor. Anyway, after working on this for 16 years, he published Pounds and Inches, which is a book that we have available online at our website. It was a new approach to obesity. It's systemic in its nature. He worked on it for about 40 years, so he's got a really long track record working with thousands of people. It utilized a very low-calorie diet, and unfortunately that's what most of the research has looked at, is it looks like just a diet. Well, it's not just a diet, and it's not just the HCG. It's the combination of the two as part of a very specific structured plan, which I believe we have improved upon to make it even more effective in the long run. But it uses, and it always has used, a prescription dose of HCG, and that's what has been unique. There are programs all around the country now, but a lot of people, because their doctors were not familiar with HCG or were afraid to prescribe it, they would go online and get the homeopathic HCG. And they would lose weight. And there's always been this question, is it the HCG or is it the low-calorie diet that causes people to lose weight? And I'm going to answer that question in just a minute. The HCG molecule is a very well understood molecule. It's the pregnancy molecule. It is also used in fertility treatments, and more people are using it for weight loss as well. It can be used for other reasons. Hypogonadism. I actually have a young man who had a very low testosterone level, and by using HCG, we're able to dramatically improve his testosterone level. It can be used for infertility. It seems to stimulate ovulation and egg maturation. And it is used for visceral fat loss. Now, this is what's called an off-label use. There are a number of medications. I was just reading this morning, like, for example, gabapentin is a medicine that was used for seizures, but now it's also used for chronic pain. It's an off-label use, but as long as it's physician prescribed and supervised, it's not against the law. It's not considered bad medical practice unless you're being, in some way reckless with it. But our program is an extremely well-structured program that has its roots, in my experience, back into the 1980s. When I was a physician in Salina, we started WellPlan, which was one of the very first lifestyle modification wellness programs. And so you could think of what we've put together here at the Reardon Clinic as the new modern version of the original wellness plans. The difference being that back then, people were beginning to show the signs of the obesity epidemic. Now it's a full-fledged epidemic, and we're past the stage where we can kind of hope to deal with it. We have to deal with it, because if we don't, I think it's going to continue to pull our healthcare system down. So it is a studied program. There are a number of published double-blind placebo-controlled studies. Not all of them showed good results, but not all of them followed Dr. Simeon's protocol. And if you don't do the double-blind study in the same way that the doctor prescribed the treatment, you're not going to get the same results. This study, which did follow Dr. Simeon's protocol, where they looked at 20 females on 500 calories and the sub-Q HCG injections, compared them to placebo, and it was double-blind. The trial lasted 6 weeks, and the HCG group showed statistically significant results compared to controls. More overall weight loss, more average weight loss per injection, greater average percentage loss in their starting weight, and a higher percentage of daily participant responses of little or no hunger. And that's been one of the big bugaboos for people on a diet program, is they feel so crummy. They get depressed, they feel irritable, their skin sags, they kind of like lose their good body shape. And so one of the nice things about HCG is that it does help people resculpt the body. As they're losing the body fat, they are actually resculpting. And there's a greater sense of well-being in terms of using the HCG. And there's published research to show that that is true. So men, the HCG helps them to increase their testosterone, and they build muscle mass. This is another big selling feature of HCG. Most programs, it'll cause you to lose muscle mass. We do BIA testing, which is a type of monitoring of your body composition as you go through the process. So we are watching your muscle mass. Our goal is to help you gain muscle mass and not lose it. And part of that in men is because it boosts their testosterone. It also regulates the hypothalamic set point. There's a set point that helps you, your body tells you when you're hungry, when you're not hungry. It regulates your composition and how your body utilizes the various components of your diet. And we found that the HCG helps to reset that point. And in women, it can help stimulate female hormones. It also regulates the hypothalamus. This is the part of the brain that regulates our breathing and our heartbeat, all those things that we're not normally aware of. It resets the hypothalamus as a fat regulator. Typically, women on the HCG plan will lose anywhere from 1/2 to 3/4 of a pound a day. The menopausal women have a slower metabolism. I'm going to talk why that's true in just a minute here, but they'll lose about 1/2 a pound per day. These are typical results. Men can lose at least a pound a day and sometimes more. Men either have the faster metabolic rate, or I think it may be a higher muscle mass that accounts for their faster weight loss. A lot of people say, well, wait a minute, if you're eating less, aren't you just slowing your metabolism down? But what we find is that the metabolism is not suppressed during the HCG program, because even though you're only eating about 700 calories a day, you're burning as many as 2,000 calories from those abnormal visceral fat stores. So your total number of calories burned during that time that you're on the program is about 2,700 calories. So the reasons diets fail is just, I've just been talking about this, people normally don't burn fat, they burn muscle mass. They become weak, they become tired, they become depressed and moody, and they lose their muscle mass. Their metabolism slows down. The body thinks it's a famine, and so the hypothalamus slows everything down. And so you actually lose the ability to burn calories. So many people coming off a diet, they can't, matter of fact, I think dieting is a major cause of obesity. If you've been on a number of diets, you've probably slowed your metabolism way down so that when you do come off of the diet, it doesn't take as many calories for you to regain the weight back again. Plus this huge recidivism rate, which means that you tend to regain, and a major discouragement sets in, because it's hard work. It takes some real discipline and focus to lose weight. And so you may try to diet even harder a couple cycles, but after a while, there's a tendency to just want to give up because of this vicious cycle. And so that's a common event. Now, what Dr. Simeons observed that helped him to discover this, he was working in India, and back in the 1950s, there was a lot of, it was a poor country, and so there wasn't a lot of excess food around, and so calorie-deprived pregnant women in food-scarce India were giving birth to full-sized, full-weight, healthy babies. And he kept noticing this and wondering about it. Where did they get those calories to grow those babies? And then the number 2 observation was, as an endocrinologist, he was dealing with Froelich syndrome, which were the adolescent fat boys that had the pituitary disease. And when they were put on low-dose HCG, their body resculpted back down to normal. So he deduced that the HCG in the pregnant women and the HCG in the fat boys was promoting the mobilization and consumption of the abnormal and excessive visceral fat deposits. That's the key thing that makes HCG so different from anything else. It's not an appetite suppressant. You're not faking out the body. You're actually stimulating a rejuvenation of the hormonal system through the HCG. Here's a picture of the Froelich syndrome, and you can see what they look like. And they had a kind of feminine obesity in males, growth and sexual retardation, headaches, retardation, just almost like a diabetes type thing as well. And that reversed with HCG therapy. So what HCG is doing is it's regulating this part of the brain called the hypothalamus, which secretes through the pituitary and then regulates the entire hormonal system. And so this controls all the involuntary functions of the body, and it's where we suspect the set point is in terms of how your body stores and handles calories. So here's the question a lot of people ask me is that, okay, doctor, if I went on a 500 to 700 calorie diet, wouldn't I lose the same amount of weight as I would if I were on HCG and the low-calorie diet? In other words, would just starvation on a low-calorie diet do it? And the answer is probably yes, you probably would. And that's been the big confusion when we talk about HCG, because a lot of the people that went on the HCG homeopathic, they probably were. I mean, we went into this in great detail, but HCG homeopathy is really not a true branch of homeopathy. That's a whole other story. But some people have been successful with it, but they're probably not doing what they need to do, because people that go on a starvation diet will lose muscle mass. It'll decrease your metabolism, severe hunger and irritability, increase fatigue. increased risk of infection, and chance of cardiac arrhythmia because of potassium loss. So that's the reason why for about 5 years people came to me saying, can I do HCG? And I'd say, no, you don't want to do HCG because it's a starvation diet. I did not understand at that point that the HCG helped to mobilize body fat and maintain muscle mass, that you did not get the irritability and the severe hunger, that you did not become tired. A lot of the patients that we've done have felt the best they felt while they were on this particular program. It's a whole different way of losing weight. So these are the things that set people up for defeat. If they have that metabolic slowing or their hormones become even more imbalanced, one of the things we try to evaluate for is if a person comes in tremendously stressed and their adrenals are really tired, they may not be ready to start the program because that's something that can interfere with the process. Sedentary lifestyle, if you've got a severe disease going on, that may be a problem. Your genetics could be a problem, but more often than not, it's an epigenetic problem, which means how are you making choices that's affecting the expression of your genes, and we want to help you make better choices. Emotional trauma, PTSD, not ready to change, failure to eat breakfast, unsupportive relationships, and chronic infections and the pot-belly syndrome. These are all reasons that we now are addressing in the context of the HCG plan. So this is what I call the web of causes of obesity: chronic infections, non-foods, emotional eating, endocrine disruption, toxins, inactivity, stress, and inflammation. This is very tough for people to break out of because all of these things interact with one another. You know, non-foods can contain toxins which can disrupt your endocrine system, which makes you less able to handle stress, that leads you to more emotional eating, that leads you back to non-foods, which can set you up for chronic infection. You don't feel like doing anything, you become inflamed, and you just build up more toxins. So you get caught in this web of causes. So any program that's going to help you sustain a weight loss needs to begin to address these different causes. And that's what we've done in terms of taking the HCG program from a weight loss program to a life care program. We have to address these things. There are a number of hormones, and I'm going to go through these really quick. There's no time, but we got Julian Michael's book, Master Your Metabolism. We found out one of the major reasons people regain their weight is because their hormones are completely out of balance. We talked about insulin, all the things that it does. It's in your handout. You can test yourself and see whether or not you have symptoms of insulin resistance. I would spend a lot of time helping people work on thyroid. We find that's very commonly a reason why people are unable to lose weight or cannot sustain their weight loss. Here's a test that you can test yourself on. The estrogen issue, Dr. Kallmeyer did a very elegant lecture on estrogen dominance. There's all kinds of environmental xenoestrogens in our environment that's causing the body to hold on to fat and to become insulin resistant. So that's a major issue. And so you can check yourself there to see if you've got estrogen dominance. So these are the man-made xenoestrogens, synthetic estrogens that are in the beef, the phytoestrogens, and the visceral fat. You know, as I showed you, those guys that have the breast development, they've got too much of the estrogen being made due to their fat cells responding to aromatase and converting their testosterone into estrogen. Post-menopause, this is a big, every woman that I see that's in menopause say, doctor, I don't know what happened, but I cannot lose weight. There's something about menopause that has really screwed up my metabolism. And we can explain it. That if you know, the body attempts to hold on to the estrogen-making areas of the body, which is fat. And so if you have more fat, you'll make more estrogen, but unfortunately, insulin increases with that estrogen, and that causes insulin resistance, and then you have the buildup of visceral fat. And so estrone, which is the menopausal estrogen, is 50 to 100 times higher in overweight postmenopausal women than otherwise. So there's a number of reasons why this happens. And what we're doing is we're starting to deal with that issue instead of just letting it go. So estrogen dominance can affect both men and women and set you up for obesity that you can't seem to overcome. And here's I was talking about how males need some estrogen, but it can cause problems if they've got too much. And as a male, you can take this test and find out if you fall into that particular category. So here we are. This is what we have to offer to kind of deal with these fairly large problems. And I think this is one of the reasons why so many doctors are pretty nihilistic when it comes to weight loss. A lot of the doctors you talk to, if you're overweight, they'll start talking about surgery because they really feel that there's nothing they can do to help you. And many of them don't have the extensive staff that's necessary to give you the education you need to deal with all these extraneous issues that keep you locked into the insulin resistance syndrome. So this is why we here at the Reardon Clinic, I've dreamed about this for many years, and I think we finally have it a reality now. It is a comprehensive lifestyle re-education program. Now what makes it work, because it does take work, but to do work you need energy. And a lot of people, unless they get some weight loss, they can't get the energy they need to start to make the lifestyle changes. And that's what I think Meg will agree with, that when people start to lose that pound, that half a pound to a pound every day, there's so much excitement that's generated, and they're actually feeling better or feeling good, that they now are motivated to take a look at, okay, what are the lifestyle choices? What are the things that I need to do in terms of my thyroid? How do I need to work on these hormonal issues? You need to educate yourself about this. And so we have people track their weight in the journal. This is our own, we've rewritten the books on this. This is our own journal that we're publishing. We have a guidebook which gives you the basics of our program and all the things you need to do in order to lose weight, lose the visceral body fat. But what's even better now, we have, a good friend of mine, Dr. Hyla Cass, has been working on this herself, and she's had a weight loss program. She has written a wonderful book called 8 Weeks to Vibrant Health, which is here. And each week we're going to have people work on a different thing, a different topic. So for instance, here's the chapter heading. So like in week one, it's kind of beginning your journey to better health. Week 2, self-evaluation, which we do. We do laboratory testing as part of our treatment plan. Going over the diagnostic tests. What do they really mean in terms of your health? Outlining your plan, balancing your diet, detoxifying your body, exercise and self-care, evaluation, and long-term planning. So we work this in as part of your 8 weeks that you're on the HCG program. And then every Tuesday night from 5:30 to 6:30, and if there are those of you that are kind of interested in what we're doing, but maybe you're not quite ready to jump into the program, Meg has a call-in kind of like show or a call-in line. It's a group call-in where she will be talking about these different topics that I mentioned that so commonly lead to defeat of people trying to maintain long-term weight loss. Stress, brain chemistry, sex hormones, thyroid and adrenals, syndrome X, digestion, environmental toxins, and etc. So this program addresses all of these reasons why people typically fail. And just to, our commitment to this, we actually did research on the first 50 people that we put through the program, and that research was published in the International Journal of Medical Sciences if you want to look this up. Nina Mikarova was our lead researcher. By the way, that Meg Beasley, is that Meg back there, Fuson, that new name? And so our subjects, we did 50 subjects after 40 days on the HCG. They had a 5% loss of muscle mass. So there was a little muscle mass loss, but we have compensatory programs for that. 12% body fat loss. They had significant weight loss during the maintenance that continued. Their cholesterol and their LDL cholesterol went down. Their blood lipid profiles improved. We do a test here called endothelial progenitor cells, which have to do with the renewal of the inner lining of the arteries. Those went up 69%. You can see how weight reduction and redistribution of fat occurred in our 50 subjects very nicely. This is a school teacher who I just saw about a week ago, and she's continuing to show these same trends. This is her body fat has gone down. Her muscle mass has continued to go up. So here's the statistically significant decreases in serum LDL and total cholesterol in our subjects. Just some of the improvements in body chemistry. These are in your handouts, a summary of the tests. In summary, the treated subjects showed a decrease in BMI on the average of 8.1%, plus or minus 2. So we have changed the protocol. Dr. Simeon's back in the 1950s was only putting people on 500 calories, but several bariatricians here in the United States who are working with the Simeon protocol found that you can use up to about 750 to 800 calories, and that will still put the body in the starvation mode that will allow the HCG to work. So what we use instead of a very low calorie diet is a low calorie diet of 550 to 800. People are more comfortable on the low calorie diet. There's more protein in the low calorie diet. So that's better preservation of the lean muscle mass, increased fat burning, better appetite control. And there's a breakfast. You know, the original Simeon's protocol was just coffee and maybe an apple. And now we have some egg whites for breakfast in there. So you can kind of compare the 1950 Simeons to what we're going to call the 2011 Simeons. There's not a big difference, but we have more choices in terms of how you can get the HCG delivered. Back then he was only giving it by injection. We can now do sub-Q, nasal, oral tablets, or sublingual drops. The safety is excellent. We also supply a very nice packet of multivitamins to prevent nutritional deficiencies. We continue to recommend about a 30-minute walk per day, though you do not have to exercise. Matter of fact, we encourage you not to exercise too robustly while you're on the program. So in conclusion, we have a reputable prescription strength HCG. We have an updated protocol. We have structured nurse educator appointments, and we have very excellent feedback on Meg. She's just a really wonderful person that you'll love to get to know. Laboratory pre-testing and weekly BIA tests, that's the body composition testing, so we're monitoring your body composition all the way through this. High quality vitamin supplement support. We have some additional support such as IV nutrition, IM B vitamins, and auricular therapy. If you are having some hunger issues, we have ways to deal with that. And then we have this life care plan, comprehensive lifestyle education, using Dr. Hyla-Cass's book as kind of a textbook. So remember this 10% solution. If you can do something to help you get down 10%, it significantly reduces your mortality and morbidity. So it's very much attainable with just one cycle of this plan. And then if you add in this life care plan, the lifestyle education, that makes that 10% loss sustainable. So 2 words I want you to go home with today: attainable and sustainable. So at this point, I'll take a few questions, but I'm going to have Meg come up and just kind of help me out because she's kind of done a lot of the footwork of this. The nice thing for the people that have been to the Reardon Clinic before and had food sensitivity testing, we can modify the basic Simeon's list to take into consideration your food sensitivities. Mm-hmm. I've also done a sheet. We haven't used it a lot, but there are some people that have had some success with blood type testing, and so we have modified the basic Simeon's to where we have options that you can substitute to fit your blood type diet. So we have made some adjustments there.
And we've dealt with some vegetarians and people who have to be very selective with their food choices. So we have different menu choices for them as well. So we will analyze all that once you come in. Any more questions? You know, our program, that when we set it up over a year ago, it was very methodically set up as 2 different programs. And we have a shorter program that lasts for 51 days, and then we have a longer program that lasts for 85 days, depending upon how much weight it is that you're wanting to lose. So, you know, the 51-day program is set up for those who want to lose 20 pounds or less. The 85-day program is set up for those who would like to lose 20 pounds or more. So, it's whatever your desire is and what your need is, but those are choices. And I think in the handout it even tells you a little bit more about how those are structured as well.
How many people have gone through the program in the last year?
We've had a little over 200 patients that have gone through the program. So as you know, with that amount of patients, we've learned quite a bit of what works and what works best for people. And so that's prompted the modification in the calorie level and protein level, even levels of HCG that we give people. So we've learned a lot over the last year.
A lot of people come in obviously to lose weight and get their health back. What are some of the side benefits that people talk about as a result of going through the program?
I tell you, I've had people that have continuously told me their increased energy level. They sleep better at night. I hear that right from the very beginning, how people tell me they're sleeping much better. They don't have the hunger issues. They don't have cravings. And if they do, we have ways to treat cravings that they have. So it's a very positive thing to hear the good results of that.
I've heard several of the fibromyalgia patients, and fibromyalgia are people who deal with chronic muscle pain and body pain that's kind of a mystery to conventional medicine. They report reduced pain while they're on the program. There's a real sense of accomplishment and regaining control of one's life. I know that can be true for any dietary program, but it seems like even more so with this. And I think the more we bring in the additional education, it kind of gives people a whole new perspective on what they need to do when they finish the program, because this is not just a diet. This is a revision of who you are in terms of who you want to become and what you're going to need to do to keep it that way, because it's not just a matter of losing the weight, it's keeping the weight off.
Exactly.
And making better food choices along the way.
That's probably what stands out our program out from any other program that's out there, is the life care that you learn afterwards, changing the lifestyle habits that you have, eating the right foods, knowing how your body responds to foods, exercising, getting out the mobility issues that, the increased mobility issues that people find. There's so many lifestyle changes that have come out of this program, and so our life care, our aftercare program is something that we're very proud of with this. So it's sets us out way and over above the rest of the programs that are out there.
Plus, if people do have a complex illness, the Reardon Clinic has 35 years of working with all the people that most of the doctors don't want to see anymore because they've not had success and they don't know where to go, so they come to see us. And so we do a comprehensive bionutritional profile and looking at all the underlying factors that enter into why a person is stuck. And so if we have someone who's a really tough challenge, Dr. Kallmeyer and myself are also here to kind of help out in the middle of the program if you need special needs and special diagnostic dilemmas.
I don't see anything in the handout about you were talking about the shorter versus the longer.
Oh, okay, in the back.
Tiffany has some more additional handouts in the back. As you leave, you can grab one of those and it'll explain it a little bit.
Yeah.
And you can also go onto our website. It also explains it in detail under the reardonclinic.org website. Okay. Any other questions?
It's an age range that is appropriate for this type of weight loss program.
I've dealt with a variety of ages. I have two people who are underage that come in with their parents their parents have some real concerns with their children going into obesity at a young age. So we're really working with nutritional habits with them, changing their eating patterns. It's been very successful. The majority of people are probably anywhere from 40 to 55 that come to see me. They're at a point in their life where, like Dr. Ron talked about earlier, their body's changing. They don't know what's happening. They don't know why their girth is spreading, and So these are issues that bring them in, and those are issues that we can definitely deal with. But usually it's about a 40 to 55 range, but we've had them older and we've had them younger.
We've had a number
So-
of retired people. Retired people are in a kind of a unique position to where they can almost make this a full-time job for a while, where they really dive into it and they have the time and the resources and the educational interest to really do what they've wanted to do for many years, and it's quite exciting for them.
You know, for a lot of my patients, it's like a renewal of life for them. They restart their whole life, and they have a different perspective. They look at food differently. They realize why they're eating. They realize what their eating habits are and how sometimes they sabotage themselves. So there's a lot of renewal aspects that come out of this program, and it's not just the weight loss. That's a bonus as far as I'm concerned. The rest of it, and the greatest part of it, is your lifestyle change and those habits that you can take with you and use for the rest of your life.
The program kind of pays for itself. I won't say it pays for all of the costs, but because you're, you don't realize how many little addictive things you do until you go on this program, and how much extra you eat that you don't need to eat until you do this program. So a lot of those things drop away during the program, and so you're spending a lot less on those like ancillary chips and frappuccinos and things like that. And so that now you get down to basics and you realize, gosh, I really don't need as much, and everything runs cleaner. You could almost think of this as a kind of detox program, because you're detoxing excess body fat. The body fat stores a lot of toxins, and so you're getting rid of toxic chemicals from your body at the same time. You're getting rid of toxic habits. And a lot of people who are struggling with weight have some very toxic self-attitudes that suddenly come out, and they're able to deal with them. So there's some major detoxification that goes on with this program. Anyone that has a trouble with diabetes or pre-diabetes, I strongly recommend this, because that's been one of the most dramatic things we've seen, is that people that we have to monitor them close, because we have to drop their diabetes medicines down, we have to drop their blood pressure medicines down, we have to keep that in check. Otherwise they come in, their blood pressure's too low, or their blood sugar's too low. So those are one of the things that having the regular visits is helpful for. And then plus we have you keep a journal. This is right now this is the Reardon Clinic journal, and we've actually done it all ourselves, and we've got the guidebook is just about ready to be published as well. And this is based upon our year of working with all these clients, helping them figure out how to keep track of all these things and what's important and what's not important. So there's a lot of work that's gone into this, and so it is a pretty well thought out program. It has this basis in Dr. Simeon's work back in the 1950s, so it's not new, but it has been evolved to meet some of the modern needs and some of our new understanding about protein and whatnot. So I think it's really a pretty good deal if you get a chance and you're interested. Like I said, if you're not ready now, if you give us your email address, Meg will send you an email every, Monday night, or you'll send it out every week with what the topic is and the code, the telephone number and the code, so you can do the call-in. There's no charge for the call-in, and we're making that for people who are interested, people who are in the program, and people in the after they're finished with the program, so that we have a forum that they can join in, and a lot of people want to tell about their success. Some people want to they have other issues that have come up, and so Meg is a great resource person to kind of help you work through that. So we don't leave you high and dry.
And some of the questions I've had about the conference call, Dr. Ron, is some people say, well, if I don't get there right on time when it starts, can I call in, a few minutes later? And yes, you can call in at any time through that hour.
Have you guys done
can-
conference
you
calls?
Can hang up at any
You
time
call an
through that
800
hour.
number, you type in a code, and it's like you're on a radio talk show, but you're all listening in. It's like you're there in the room together on the phone. So we had a lot of people that they were just busy and they just didn't have time. We started to do it just here in this room, but people had to take time to drive out. But the conference call is pretty easy to do. Even if you don't have anything to say, you can just bring it up and listen in to what other people are talking about.
Absolutely. Any other questions, Dr. Kohlmeyer?
No, I was just going to make a comment about how we calculated the cost
of food
per day on the program, and it was $7 to $10, 10 if you bought organic. So if you add that up for a week, that's $50 to $70 a week. So if you're
Right.
spending $150 on food a week, you know, on average, so you can save a whole lot of money if
Yeah,
your cost is a concern.
Plus the cost of the medications that you'll be reducing, most likely.
Absolutely. You can cut your grocery bill to a third to almost a half with these HCG foods. And what you had for lunch, by the way, was an HCG, some of the HCG recipes that are allowable while you're on the HCG. So the portions were probably, and the chicken breasts were probably a little bit larger. We allow you to have 4 to 5 ounces of protein, and I think the chicken breasts that were here today were approximately around 5 to 6 ounces. So there is a recipe guidebook that we have that gives you all kinds of suggestions on what to do with your food, and it's pretty amazing how creative you can get with these foods. You know, you can use all kinds of spices, herbs, natural herbs. So we have that recipe book available as well. And you can get some recipes online too.
Okay, well, thank you very much, everyone, for
Yeah,
coming
thank you
today.
for
Hopefully
coming.
it's got you thinking, and if there's anyone that you know that is interested in this, we'll probably end up putting this, this video on the website, so you could have someone call and watch the video, or they could call in for the Tuesday nights if they wanted to kind of get some information that way. So thank you very much.